Good morning, everyone. Myself, Dr. Sakshi Bharadwaj, application scientist. On behalf of Feltham Technology, I would like to extend my warm welcome to you all in today's interesting session, that is how to overcome resistance in microorganism, challenges and opportunity. Before going further, I would like to introduce the profile of my company. Eltem Technology is a leading company into the 3D bioprinting. Since from the concept designing, its engineering, manufacturing, tooling, till the product into the market, it is providing all the support to their customers. Altem Alliances, you can see here, like Dissolve Systems, Arctic 3D, Stratasys, Cell Inc., Hexagon, Intech. The other important wing of Altum Technologies is life sciences, where we are using the BIOVIA Discovery Studio, Material Studio, and Pipeline Pilot. Today, we have Dr. Bala as our speaker. Dr. Bala going to talk on how to overcome the challenges in resistant and microorganism and how we can take these opportunity with the help of BioVia Discovery Studio suite to design our molecules, how those molecules could be helpful and having the more potency to overcome these challenges. Now, I would like to introduce Dr. Bala. Dr. Bala
Yes.
Subramaniam is a research scientist in anti-cancer bioscience, Hyderabad. Dr. Bala has done or having the expertise in these resistance kind of challenges in his career. Basically, he is a medicinal chemist with a computational background. So I would like to welcome you, sir. Over to you.
Yes.
The platform is yours.
Okay. Hi. First of all, myself, Dr. Bala Subramanian, and I have done my PhD in 2021 at Anna University in the field of medicinal chemistry. So, in this lab, in previous lab, during my PhD, we have developed the one lab. The name is Drug Discovery Development Research Group. We have the team with my guide. So from the lab, we always focus on the discovery of the new compound, particularly for challenges disease. So that only we have chosen the antibiotic resistant microorganism to find out the suitable compounds. So here I have to explain how to overcome the resistant microorganisms and the challenges and the opportunities. Mainly, I have to explain and what is the strategies to design and identify the potential compound against the antibiotic resistant microorganism using the BioVia Discovery Studio. In online, so many in silico software there and other software there. From my knowledge, during my lab session, I have used this software and applied all the protocol methodology in this software. Finally, I find out that some novel compounds and also that compound also showing a good biological activity in the in vitro cells so that we in our lab always believing about the discovery studio software giving the perfect results. So here also I'm using the same software. So first of all, I'm going to explain the antibiotic resistant. This is the data is retrieved from Center for Disease and Dynamic Economic Policy. It will update every 2 years, and how many drugs are resistant in worldwide. Mainly in India, most of the drugs are resistant as per report. From the report, mostly the fluoroquinolone drug also more resistance. Here we can see the data in all over India. So, and further, this is the resistant map. You can see India has the highest rate of resistant E. coli, particularly for fluoroquinolone drugs. So many drugs is there, particularly fluoroquinolone is much more resistant in compared to worldwide in India. So that our we decide to discover the new fluoroquinolone derivatives, particularly for resistant E. coli. First, I am going to show the what is the fluoroquinolone drugs. These are currently used fluoroquinolone drugs. As we know that ciprofloxacin, levofloxacin, moxifloxacin, ciprofloxacin, these are the derivative of fluoroquinolone drugs. These type of drugs are now currently resisted as per Center for Disease Dynamic Economic Policy. So that there is no alternative drug to overcome the resistant organisms. Till now, there is no alternative drug for overcome the resistance. So this is the intentions motivated us to discover the some derivative drug, particularly for resistant E. coli. So actually, I'm background of the chemistry, so I'm not going to waste of the time to synthesize the first synthesize the generally in drug discovery field. What they did first, they synthesize the so many molecules, then go for biological activity. Some molecules are going the activity, some molecules are does not giving the activity. Like that only they finally find out the active molecules, but it will take the lots of time, cost. So we have to plan to reduce. So we have choose the in silico software. From the software, we have to find out the potential drug. Then we go for biological activity. This is we taken for strategy. And one more thing, here I am going to explain only the fluoroquinolone drugs, because this drug only I have used in my PhD time. But in this presentation, I have so many methodology, strategy like that. So we have used this strategy methodology to for other drugs, other derivative, whatever you have planned like that, we can easily apply. So here I'm going to explain one of the example of fluoroquinolone drugs. So how I discovered the new fluoroquinolone drugs to overcome the resistant E. coli. Oh, no, sorry. When you go for planning to discover a drug, we have to find out the target and mechanism of the actions. So from the literature survey only, we have to find the target. From the target only, we have to find out the next process. So here I choose fluoroquinolone drugs. As we know that fluoroquinolone is to bind the DNA gyrase of E. coli and inhibit in the DNA replication. This is the standard mechanism. So we from this information we found out DNA gyrase is a responsible target protein for resistant E. coli and E. coli. So that we planning to choose the DNA gyrase protein for further drug designing. It is the web page of protein data bank. This is the main source to retrieve the protein structure of the any target or any disease like that. This is the main source. Here we can search any target protein. We can find out the 3D structure of the target. But unfortunately, some of the if For example, if you find out the any target from the literature, that protein is not available in the PDP. So what will go? We have to go for homology modeling technique. This is the one of the technique. Using the technique, we have developed the homology model of protein for further drug design process. When you go for drug designing, the receptor information much more important. Without receptor information, we cannot design a potential drug. This my I have learned from this information from the literature survey, so that I'm always focused on the target of the protein. But for my studies, I could not find out the um, DNA gyrase protein. DNA gyrase protein available in the PDP, but I'm looking for resistant, which means mutated DNA gyrase protein. I expecting for drug designing, because mutant DNA gyrase protein is responsible for resistant E. coli, but that resistant protein is not available in the protein database. So what? But I could retrieve the resistant sequence from the website. So from the sequence, I go for homology modeling technique. Previously, I searched what is the free software to develop the homology modeling, and some software there like Swiss model is there. Here I tried, but I could not get the what I expected model from the model, and also I expect the active site, but I could not get the accurate result from the Swiss model. So I'm go to use the Discovery Studio software. In this software, some protocols there, like basic local alignment search protocol. Using this protocol, we can find out the suitable template and sequence. And the next one protocol is there. Then align multiple sequence. Here we can align our target sequence with the template sequence. So after that, we can go for build homology modeling protocol. Using this protocol, we can predict the what we expect a model with the help of the target sequence. And mainly, we have to confirm the structure is correct or not. So that we go for dope method is always there in the Discovery Studio, is the high resolution discrete optimization protein energy method. So using this method, I can refine the loop region. The loop region very important for my target. So I can refine my loop. After that, they give you some scores. Based on the lowest dope score, I can choose the one model protein. After that, we have to find out this model are good, the stability of the protein is good or bad, good or not. We have to confirm on the various validation method. In this software is a Ramachandra plot is there, and other online free software is there like ProQ, ERAD, Verify 3D, and ProAsia. These are the online free software for analyzing the protein structure. So we can after finishing your homology model, you can use this online server to find out that our proteins are good or not, like that. So this is I have developed the homology model protein. So first is the wild type sequence. This is the target template sequence. The second one is okay. 1 minute. The second one is the my target sequence. So we can see that this is the mutated sequence. These are the got from the literature survey. So I need the this type of the sequence with the model. So finally I got it from the using the Discovery Studio software, and also I superimposed with this protein with the wild type protein. So more or less are same. So I found that okay, our developed homology model protein was perfect. So once proteins got it, next I go for active site information. This is very much important to for drug design method. So I found that in the active site, most of the amino acids are showing hydrophobicity. This is the active site. Here only all the fluoroquinolone drugs are going to the bind. So I focus on this region, this size, and everything I have calculated, because our aim always going to the discover the potential compound, so that we always focus on the active site, and in the active site we have to analyze the information of the amino acid, because these amino acids only responsible for binding with our future compound, so that we are always we carefully evaluated. So we found that most of the amino acids are hydrophobicity. So we planned, okay, some amino acids are more hydrophobicity. If we are going for drug design, we have to include the more hydrophobic group, because if we are increase the hydrophobic group, it will give the hydrophobic interaction with the hydrophobic amino acid. This is the common concept from I got from literature survey. So from the information, we go for structure based drug design. Here we can see the first image. Serine 83 is a normal protein, and next one is the mutated amino acid protein. Next, and also we found that de novo receptor tool and de novo ligand generation protocol in the Discovery Studio. Using these two protocol, we can find out the suitable small molecule, which small molecule is correct orientation with the target protein, which means it give you some idea about the structure and which ligand is suitable for in this position. Like that, it will give us some informations. So, for example, if you are using the de novo receptor tool, it will give us some suggestion like hydrophobic. Here we can see the some of the suggestion like hydrophobic nature, hydrophilic, hydrogen donor, acceptor, like that it will suggest. Which means if you are putting the hydrophobic hydrogen donor receptor like that, it will bind with the this receptor. And also if you are using the de novo ligand generation protocol, it gives you a small library of the compound like OH group and a small benzene group, like that it will show the show in in the active site. Which means if you are adding this small group in our designed molecule, surely it will bind with the active site. So it is a very much information, very important information we got from this only this software like a de novo receptor tool and a de novo ligand generation protocol. Without this information, we cannot go for design the perfect compound. So like that only we got the research, we got the information. The main thing is we can design structure based drug design, but one problem is there. Once you design a potential compound with the help of the structure based drug design, we can go first retrosynthesis to synthesize that molecule. That is one method, but one problem is there. In future, after that, these drug are going to the bind the same target or not in the in vitro cells. That is the one more biggest question. If you are designing the drug, okay, but in future that drug going to bind in the active site or not, that is we don't know about, because it's a blind. So that I'm always focusing and suggesting to anyone how to design structure based along with the ligand based drug design. Both method only we can find out the suitable drug and the suitable potential compound, like that. So we got the structure based information. Next I go for ligand based drug design. The ligand based drug design full and fully based on the literature survey only we can design the drug. Without ligand based drug design, we cannot achieve the our aim. So before we are going for start the design, we have to read the any drug we are designing any compound. We have to read the structure activity relations of the any drug. Without information we cannot go for the design the suitable drug. So I choose the flow drug. So as per structure activity relationship, and the sixth position 4 3, the carboxylic acid ketone fluorine atoms are responsible for DNA gyrase binding. So that we cannot go for change these positions. Only we have to change the seventh position, because some literature shows we are increasing the seventh position, it will bind with the DNA gyrase and overcome the resistance. It is information I got the literature survey only. So I planned to add the more substitution group in the only seventh position. I'm not changing the these 6 3 and 4, because the as per structure activity relationship, these are very important to our target. So that I'm not changed it, only I have changed the seventh position. This information only on the literature survey only. So we have to apply both structure based drug design and ligand based drug design. Structure based means we have to identify the what is the nature of the active site, and the second one is we have to design the drug previously reported drug. Then only we can discover the potential drug without any difficulties. So based on the structure based and ligand based, we designed nearly 100 compounds based on the structure information and ligand based 100 compound we have designed. Next we have to analyze the activity of the 100 compound. The first choice is molecular docking. So the molecular docking is the one protocol is there in the Discover Studio software, C-Docker protocol. It's a grid based molecular docking tool. Some free software is there like Autodoc Vienna is there, some other software there. Initially I tried it, but I could not get the perfect results. Why? The reason is the docking is very very important. We have to find out the correct gravity site of the target, because each protein, if you have chosen any protein, all protein have so many cavities. We don't know about which is the active site. So only literature survey and PDP report and PDP information only we can get the active site. Here in one options there in Discover Studio, find the cavity. It will find the so many cavities. We don't know which cavity is suitable for drug binding. So using the PDP and literature survey, we can find out the active site. Here we can put the one sphere, which means in this sphere shows how many amino acids involved in the active site. So that amino acids only going to the bind. This is very very important to put the sphere. So once we put the sphere, we have to carefully evaluate what is the amino acids are involved, and what is the why that, and based on the literature way these amino acids are responsible for bonding, like that we have to find out. Then only we can find out the sphere and with the accurate positions. So then after that we go for docking process, so that only we can get the perfect results in the molecular docking results. But I tried in Waterberg, Vienna, some other software. I could not find out the accurate active site and the sphere like that. But it will cover the unwanted amino acids. So that in the result, I saw unwanted amino acids involved in the binding. This is our molecular docking results. This is the one of the biggest proof our molecule showing the interaction with the resistant amino acids. So here this is some of the molecule. Here you can see this is one of the molecule fluorogulan 72. This is I have designed. Here we can see in the seventh position I have included some major hydrophobic group. We can see these hydrophobic groups are interactive with the mutated amino acids. Here we can see asparagine 87 and leucine 83 and asparagine 80. These are the mutated amino acids. Previously I shown these are the mutated amino acids. So after careful here, I can find out that these resistant amino acids are binding with our molecules. So which means it is so we have go for correct way, and we have accurately used the de novo structure based design based on the information like that we have applied. So that only we can find out our molecule. These molecules are bind with the resistant amino acids. We can compare the ciprofloxacin. Ciprofloxacin does not bind with the mutated amino acid. This is the one of the proof why the ciprofloxacins are resistant. Further, we used the docking studies for virtual screening because initially I told for medicinal chemistry it will take so many time to identify the potential compound. So that we have used some strategies to find out the potential drug. So using the docking study and the docking score, just we screen the 50 molecules, 50 best molecule from 100 molecules. So these 10, 50 molecules are more potent, more binding activity compared to standard. So further, I the 50 molecule we are subjected to pharmacophore studies. Here, one of the molecular dynamic simulation studies. These studies only for analyze the stability of the proteins. If you go for docking, you have to analyze the molecular dynamic simulations. Then only we can find out our molecule are perfectly matched, perfectly bind with the protein or not. Like that, we can set. Here in solvation process, there in the solvation process, we can add sodium salt like that with our complex protein, and then we go for stability analysis. Here, this stability analysis is correlated with our human body temperature and human body behavior. From this, we can find out that our proteins stability is there or not. Like that, we can find out. If molecular dynamic get the good results, the docking also you done the good. So it is correlated with the molecular dynamic simulations. So without molecular dynamic simulation, we cannot go for publications because all the publications are must ask molecular dynamic simulation. From this result, only we can find out our proteins are stability is there or not. Like that, we can find out. Next, pharmacophore studies. I will tell in molecular dynamics, so many free softwares there like Dashman and GrowMax. Some others there, but I could not get the what I have said. I have to find out the easy way to get the results. But there's after so many difficulties there, so that I have used Discovery Studio software for particular for dynamic simulation studies. Then next pharmacophore studies. In the pharmaco studies is one of the technique to find out the suitable compound from the designed compounds. It is a structure-based pharmaco studies. Here, one two protocol we can is there in Discovery Studio. One is the interaction generation protocol. Here, if you are uploading the protein, the interaction generation protocol generate the pharmacophoric features. Pharmacophoric feature nothing but is the um, functional group behavior like hydrogen bond donor, hydrogen bond acceptor, hydrophobic. In generally, we will tell same pharmacophoric features behave same biological activity, which means these pharmacophoric features involved in the biological activity. So interaction generation protocol we are use now. We can find out the suitable pharmacophoric features available in the active sites. So it stores um, some information uh, which pharmacophoric fit is going to fit like that. It will go some one model. So after that, using this model, next we go for screen library protocol. So this protocol, what will do? This protocol using this pharmacophore model and fit with the our designed compounds, which means how our pharmacophoric feature of the our compound fit with the target. It is a very important technique to find out the our molecule, which means I told you initially same pharmacophore features behave same biological activity, which means the target, it shows some of the features is there in the ligand. It will bind with the target like the suggested, so that after that we have to find going to the fit our molecule. So few of the molecules fit with the pharmacore feature of the mutated protein. So from this information, we can screen the 30 molecule based on the fit value. This 50 molecule we screen with the docking. From the docking, we screen the only 30 molecule. Then the 30 molecule, we can go for ligand based pharmaco studies. Ligand pharmacore is the very important how our molecules perfectly match with the already reported drug in the market. So otherwise we cannot go for a next process. So we have to analyze the ligand based pharmacore studies. So in the ligand pharmaco studies, here one protocol is there, common future pharmaco generation protocol. Here, first we have to collect the some of the drug which are already reported in the market. So based on the information, we can develop the one model. So this common future pharmaco generation protocol shows the three pharmacophore features. One is the hydrogen bond acceptor, and ring aromatic, and hydrophobic, which shows these three pharmacophoric features are commonly present in the standard drug like ciprofloxacin, norfloxacin, like that. Which means these three features are responsible for biological activity. Which means these are very important in future drug like that it will show. So what we'll do, we have used this model to apply to the our designed molecules like that. So based on the fit value, we can choose a 20 molecules. These 20 molecules structures, behavior, and pharmacophore look like to the previously reported drug. So we believe that this 20 molecules showing the standard drug like that. Next, QSR, a quantitative structure activity relationship. It's one of the important. It is only applicable for if you're going for ligand based drug design. It is not applicable for structure based drug design. I will tell why it is suitable for ligand based drug design. In QSR, we can predict the activity of the any compound without go for synthesis and in vitro bioactivity. We found that this is the one opportunity is there like that, so that we applied the QSR in our molecule to predict the activity. Our aim is always find out the potential compound without fail. So we use all the strategy techniques of the discovery studio. In the QSR studies, one protocol is the calculate molecular properties protocol. Before we have to collect the already reported standard drug, nearly 50 molecule that best for QSR studies. So we have to load it. So this protocol calculate the log P, molecular weight, hydrogen bond donor, acceptor, ring rotator bond, everything molecular property will calculate. After that, um, using the generate training set test set, this protocol automatically split the molecule in the one as the training set and the test set. After that, create multiple linear regression model. This is the protocol to generate the one equation from the already reported molecule. This is the generated equations. Using this equation, we can predict the activity of the any molecules. Before I predict the activity, we have to check is it good or not. Like that, we have to check. So what we'll do that this is the predicted activity of the known compound. Here is the these are the literally collected standard drug and molecule. These are the experimental activity of the MIC, which means in literature survey they have reported these are the experimental activity. So using this equation, just we have to predict the already known molecules. So also we predict the activity. After that we correlate this equation are going to predict the correct value or not like that. So we check the graph. This is the predicted activity. This is the experimental activity. So and the R square value is nearly 96, which means this equation predict the 90 percentage correct activity of the value. So we believe that these equations are is good. So you can use this equation for further any molecule. So from the MIC values, from the predicted activity, we choose the 15 molecules. I will show later the MIC QSR predicted activity. So next we go for ADMT. This is very much important in the medicinal chemistry. We have to calculate all the properties of the molecule, and the molecule should be follow the drug-like properties. And some free software there, Swiss ADME, O series property like that is there, but we cannot. I could not find out the blood-brain barriers absorption, hepatotoxin like that. So I have faced some failure. So here in this software, we predict the accurate value of the drug-like properties. Here you can easily predict the blood-brain barrier level, absorption level, solubility level, hepatotoxicity, cytochrome inhibitor or not, and plasma protein binding and LRP. These parameters are very much important for drug-like properties. Then only if your drug pass in these parameters, then only the drug considered as the molecule considered as a drug. So based on the ADMT results, finally we choose the 10 potential molecule, which means these 10 molecules are good binding affinity and good structure-based pharmaco model and QSR. It is passed the QSR and so in the ADMT. So we found that these 10 molecules are potential compound. Surely it will overcome. It will in future overcome the antibiotic resistance like that. And the main things we found that one protocol is there. Name is TopCut. From the TopCut protocol, we can predict the toxicity, mutagenicity, and all the in vitro properties. Actually, these properties are we are using the medicinal chemistry after the synthesis the molecule like that. It will take much more time, but luckily this software always predict this information before the synthesis before the synthesis. This is much more information like that. But we found that we have doubt the software going to predict the correct or not. We checked it. Actually this is the actual result of TopCat. What will do it that this algorithm following a FDA reported molecules. FDA reported reported one list. Some molecules are toxic or not like that will show. So based on the information, we can find out that our molecules are going to predict the toxic or not. This is the one of the example. Is a plant compound we checked initially. This compound going to toxic without without synthesis and in vitro results. We can find out this is a toxic. I don't know how it is going to toxic. As per FTA source, this type of fraction is there in the any molecule. It going into toxic. So it is we have impressed this result. Okay, this software going to predict the accurate results. And one another molecule is there. It is non-toxic, which means in FTS soda, if the molecule has this type of fragment, the molecule has non-toxic. So we believe that this molecule has a non-toxic. So based on the top cut also we found out our molecule having a without any toxic like that. Here we can predict the carcinogenicity, mutagenicity, skin irritation, and oral LD50 also we can find out. And this is the final one. Uh, Finally, we have designed these 10 molecules is a potential compound to overcome the antibiotic resistance from the designed compounds. Next, I'm going to the actually up to level. This is the only in silico report. From this in silico report, we find out these 10 molecules are potential compound. Further, we have to check this molecule actually going to the work or not like that. This is the in silico results is correlated with the in vitro analysis. This is the one of the example is the zone of inhibition. Here you can see we use ciprofloxacin. Ciprofloxacin does not show in the any zone, but our virtually screen the molecule using this discovery software showing the zone of these are the fluoroquinolone resistant E. coli. So ciprofloxacin does not show the any zone. Our synthesis molecules are going the good activity at the zone. So we believe that our virtually screened molecules are are inhibiting the E. coli bacteria like that. This is the zone of inhibition, and some more we evaluate like some more in vitro results we reported like protein inhibition assay and superkine assay that are previously I published in the article. I'm not include like that. So here I'm going to correlate the predicted QSR result along with the MIC results. So this is the first table. Sorry, this is the first table. Here we can see the QSR predicted MIC value of the designed compound. These are the designed compound. Here I can predict the MIC using the multiple linear regression equation and also some other parameters, hydrogen donor, acceptor, ring aromatic, like that we can predict it. So after the screening, we synthesize this molecule and go for check the minimum inhibitory concentration, broth dilution method. We find out that these 10 molecule of the we calculate that we find out the MIC. Surprisingly, these MIC values are 80 to 90% match with the QSR result. Here we can see, for example, fluoroquinolone 149 in vitro cell we found 0.87, here 2.07, and fluoroquinolone 70 is the 0.93 and 1.59 like that. For example, 182 is the 1.44 is 1.69, so it's much more close to the our predicted activity. So we impressed the QS our developed QSR equation is much more accurate to predict the activity like that. So in the QSR we screen the some of the molecule, that molecules also showing the good biological activity in the in vitro cells. Okay, this is summary of the my research. How I identify the potential compound. So it's a homology modeling. Initially, I designed the 100 molecules, and using the docking, I have find out the 50, and the structure-based pharmacore and ligand-based pharmacore, I find out the 18 molecule. Using the ADMT and the QSR, finally I find out the 10 molecules, and the 10 molecule I have synthesized it and evaluate the biological activity against the antibiotic-resistant organisms like that. And these are the published article. Is the one of the good article. um, Here I have explained the all the visual screening methodology, how I find out the potential compound like that. And this is the second article. Here I have explained the QSR and how the QSR results correlate with the in situ result. I can publish like that. Okay, finally I finished my presentation. Thanks for sharing time. If any question you can ask, I will answer for any question. Anybody is there?
Thank you, Dr. Bala, for the informative session. Now the session is open for the question and answers. If anyone is having any questions, you can ask to Dr. Bala. As it's uh, mentioned by Dr. Bala, how these resistance issues can be, overcome with by using these kind of like BioVia Discovery Studio softwares. It will be very helpful, and the time first of thing is to bring a drug candidate to the market. It's itself a very long, very long.
Long
What
period.
to call yes, yes. But by using this virtual or computer-aided drug designing, we can even save our time, and we can do it very efficiently also. And of course, the main thing with these kind of work is the accuracy and the reproducibility. What we can do with by using BioVia Discovery Studio, as you mentioned in your talk also, how you
Yeah,
are
I
using
I have to tell you. Actually, in first article, I can publish so many strategy I used the visual screening. In the second article, I have published the QSR, how the QSR results is correlated with the in vitro results. Here I face so many questions trouble to the reviewer because that one is a very reputed journal, Royal
correct.
Society of Chemistry. So many
Mhm.
reviewers ask how this correlate like that. I saw the step by steps. Personally, I send the mail and everything. Then only they believe. Okay, this is the equation is correct like that. So that I'm getting more time to publish these QSR results in the good article. Then only the other people are believe. Otherwise, it's very difficult to believe everyone.
Correct, Dr. Bala, because in the research, the main thing is the reproducibility with the efficacy and with the accuracy. When you can't reproduce your the result with the same manner, then your research is going to no use of your research, I would say. So
Yeah.
we have one question here. Whether you used NAMD or charmed based simulation techniques for your work from,
For
yes.
no, I didn't get there. Charm means they are asking force
In
field like that.
simulation. Yes. In simulation,
Yeah. It's 1 minute. 1 minute. I'm busy. I'm not much more knowledge in the technical, but I have the applied the charm force field for minimizing my ligand. When we
okay.
go for docking, we use the charm force field to minimize the ligand.
Adding to Dr. Bala, I would like to answer this question because we have both in NAMD and charm-based simulation in our simulation dynamic module, where we use the charm-based simulation techniques because charm with CPU mode, because it is very fast mode. So we are using this charm-based, and this is directly linked with the Harvard University. So any updation in the charm force fit, we are getting directly into the BioVia Discovery Studio. Next
So
question is, why are bacteria become resistant to antibiotics?
can you
Why are the bacteria
uh,
becoming resistant to antibiotics?
okay. Can I? Is it possible to open my presentation, or I will? Okay. Why the bacteria become resistant to antibiotics? Um, First of all, it's awareness. Um, when you are using the continuous, for example, if your doctor said that 3 days medicine for health issues, but some peoples are not continuing the time. They take only 2 or 3 days, only 2 days. After what happened? So after that, the bacteria behave against the drug, which means they mutate the amino acids. First, we have to know the mechanism. The drug going to bind the protein active site in the amino acids. This is the mechanism to kill the bacteria. So when you are using continuously antibiotic, so the protein going to the mutate the amino acids, which means this changing the position. So what happened? The drug going to not binding the amino acids. I'm going to explain my presentation. For example, ciprofloxacin. Currently, we are using for E. coli. As of now, I know the ciprofloxacin going to the bind the E. coli bacteria in the DNA gyrase, particularly in the amino acid. The amino acid name is serine 87, 83, and leucine 87. Sorry, serine and aspartic acid. These are the main amino acids. But in the case of mutation, the serine changed the leucine and the aspartic changed the aspargine. So the drug cannot go into the bind. This is the reason the drug going to the resistant.
Correctly said, Dr. Bala. In adding to that, the very common example, whatever our moms always keep on telling that you should not take the medicine in your cold and cough because it's after 3 days it will go off automatically. With the same reason, because that bacteria itself is not means it's keep on mutating. That's why any kind of medicine if we are taking, it's not going to bind that particular protein and it will help out. So, next question. Why ADMET is more important during the drug discovery?
Yeah, a good question. In the ADMT, it's a ADMT absorption, distribution, metabolism, toxicity. Without these results, we cannot tell our molecule is a potential molecule or good bioavailability like that. We cannot tell anything. Before we are going the synthesis drug or discovery drug, we have to calculate the two parameters. One is the Lipinski rule. This is much more important. You have to calculate, you have to follow the Lipinski rule before drug designing. After the drug design is not possible. So before drug design, we have to follow the Lipinski rule. So after that, we go for ADMT. In ADMT, six parameters is we can predict in the Discover Studio. Only Discover Studio, I found out that this parameter like solubility, absorption, and blood-brain barrier penetration, cytotoxicity, and the cytochrome inhibitor or not, and the log B value. These are the very much parameter to predict the nature of the drug. So based on the information only we can find out the drug. For example, if you analyze the ADMT, some drug there is no solubility. We cannot go for next process because the ADMT shows you can see the circle in the Discover Studio results. The drug is falling the outside. We cannot choose the drug as a next process. So this is very very important. Without ADMT results, we cannot tell our molecule is a potential molecule like that.
Thank you, Dr. Bala. Uh, is there any other questions we having? I have a one question, Dr. Bala. Actually, this resistant topic is making me very excited because it's always like for antitubercular drug also the same issue is there. Initially it is multi-drug resistance which is extended to extensively drug resistant, and now it is totally drug resistant, means no drug would bind and no one show any kind of efficacy or basically bioavailability. So how we can make, as you shown in your PPT also, that particular active site you have mentioned. So how you are means for our viewers also, how we can identify those particular sites using this BioVia Discovery Studio. So it would be more helpful for them. Okay, we can make a grid and we can bind it to that particular. So what kind exactly you are, how you did it actually?
Yeah, actually, it's a good question. You are asking about the multi-drug resistant tuberculosis and also MRSA, methicillin resistant
Correct.
staphylococcus. Um,
Mhm.
and some major organisms there, like ciproflox resistant E. coli and MRSA and multi-drug resistant tuberculosis. Luckily, in the protein data bank, we can find out the target protein of MRSA and multi-drug resistant tuberculosis. Some scientists are uploaded, but they are not uploaded any protein in the resistant E. coli. So that only in my PhD I go for homology modeling. If you
Okay.
are planning to discover a new drug for a multi-drug resistant tuberculosis and MRSA, it's a little easy because the 3D structure of the proteins are available in the protein data bank. So once
Mhm.
we find out the protein data bank, one much more important, we have to check the quality of the protein. We have to find out the resolution of the protein and which year they are uploaded like that. Based on the information, we have to uh, download the protein from the PDP. After that, before we are going to study, we have to carefully read the literature survey. Currently, what are the drug is there and what are the drug mechanism there, and some good journal we have to find out what are the amino acids are involved in the binding site. Simply, we can find out If you download the good protein from the PDP, in the PDP we can find out the what is the standard drug inside the active site. We can from the information we can visibly the Discovery Studio visualizer software we can find out the
Mhm.
which active site is involved and which amino acids involved, like that we can find out. So in the PDP always showing the known drug or well-known drug only bind. We are going for drug designing, so first we have to get the information from the active site. We can closely view the active site information and what is the amino acids involved in the binding, and what is the behavior, what is the nature, either hydrogen bond donor, hydrogen acceptor, like that. We have to do the so many manual work. Then only then you can get the some information. So you using the Leu algorithm, like that we can go for next drug designing, like that. It's very easy.
Okay, okay. Thank you, sir. We have two more questions. One is why Lipinski rule is important, sir.
Yeah. Lipins now currently used all the drug except medicinal, except plant-based drug. All the drugs following the Lipinski rule of five. It the scientist Lipinski, he suggested one rule, like molecular weight less than 500, log B value is the should be less than 5, hydrogen bond donor is the less than 5, hydrogen bond acceptor less than 100, like that. They suggested some rules. If any drug following these rules only, that molecule only considered as a drug. This is he suggested one rule. So why now? Because if you are without rule, anyone can design the more drug. You do you know no? If you are increase the more bulky group, more functional group, it going the more biological activity, but surely it will go the more toxicity. So that the lipins give you some rule. If you are designing the drug should be following this rule: less than 500 molecular weight, the hydrogen bond donor, acceptor, and log B value less than 5. Then only we can find out this drug does not induce any toxicity, like that they will suggest. So we have to follow the Lipin's rule of 5. Without Lipin's rule of 5, we cannot go for drug designing. It's very difficult, less than 500, but we have to design. Ma'am, my audio's not here. Your voice not here.
Uh, how pharmacophore analysis are responsible for the selective activity of the designed ligands against the this gyrase A protein
Ah,
of the E.
yeah.
coli.
In pharmacoanalysis, two pharmacoanalysis there. One is the structure-based pharmacoanalysis. One is the ligand-based pharmacoanalysis. In this case, ligand-based pharmacoanalysis not suitable for resistant organisms, because in ligand-based pharmaco, we always following the what is the drug markedly available in markedly available drug. Currently markedly available drug only for normal E. coli, not for resistant E. coli. So when you go for structure-based pharmacophore, initially I told there is no mutant DNA gyrase proteins available in the protein data pack. So that we go for homology model. Using the sequence, we developed the homology model. So we found that we have to use the structure-based pharmacophore analysis. What is the pharmacophore features? We know that pharmacophore features means hydrogen bond donor, acceptor, hydrophobic, ring aromatic, which means in generally we can tell same pharmacophoric features behave same biological activity. How we will explain? If other molecule having same pharmacophore features, your molecule having the same features, surely your molecule behave a same biological activity. This is the concept. Means same pharmacophore features behave same biological activity. So in my studies, we have to find out the what is the pharmacophoric features is suitable for our drug binding. So I told pharmacophore generating protocol. Using the protocol, I just generate the what is the suitable pharmacophore feature in the active site. That is very much important. We have to find out the spear. From the spear only, we have to find out the pharmacophore features. Then we go for pharmacophore fit value. How our molecule pharmacophore feature fit with the resistant protein. That is my answer like that.
Um, I think we are running short of time, so we can participants can send us a mail with their questions, and we can of course we'll get back to them. So I would like to thank you, Dr. Bala, once again for this innovative session, and of course all the participants. Thank you for being with us. Thank you, sir.
Thank you. Thank you.